Critically ill and injured people come to Health Sciences Center emergency. This weekend, 12 of them were lined up on stretchers in an entrance hallway because there was no room inside.
We had a lot of very high acuity patients coming in all at the same time, in particular on Sunday. And there was nowhere else for them to really go. These were trauma patients, these were neuro patients, these were patients that need HSC.
Some of these patients waited for hours with conditions like a fractured hip, broken facial bones, and a serious stroke.
People are having strokes. We have a whole process in place to try and get them into their care as quick as possible, and yet we can't move them forward. So their stroke is progressing, parts of their brain are continuing to die because we can't get that person into a hospital bed.
Dr. Merrill Paul said he's never seen the situation so bad.
Over this past weekend, we've had incidences where we had 2 critically ill patients placed into 1 resuscitation bed. So literally double bunking patients in the most acute areas of our department.
The severe nursing shortage is only one cause. Doctors say they're seeing patients who are sicker than usual because they haven't been able or haven't tried to get medical care.
It's heartbreaking. It's heartbreaking for physicians and nurses and staff to work where they know someone is too afraid to even come in because the wait is atrocious.
Doctors say all healthcare workers are doing their best.
How plausible is it that we could see somebody die sitting on a stretcher in a hallway?
I wouldn't be surprised if it's already happened.
Paul says he wants to see more very sick patients treated in other parts of the hospital.
They're not dying as a result of improper care. They're dying as a result of decisions that we've made. They're dying as a result of decisions that we're making to minimize risk to others around the department and to have that risk all reside within the department.
Sean Young says that's already happening.
We have to make sure that we're there for the most acutely in need patients. But it does mean other patients are going to wait, unfortunately, until we can actually build up that workforce.
CBC News reached out to the health minister and premier for comment. They deferred to Manitoba Shared Health. Bartley Kivas, CBC News, Winnipeg.